Natalie's story highlights the frustration that a daughter faced with many aspects of the health system when her fit, energetic mum suddenly has a stroke and her dad becomes the main carer.
This is a story about my mum Diane. Married at 19 with 2 children by 21, Diane has always been active, thriving on the challenges of her job as a secondary school teacher and her long-term hobby of building houses with her husband Miles. On retirement, Miles and Di headed off around Australia in their camper van to enjoy the great outdoors. Then in 2004, at the age of 68, Di had a massive stroke. Her prognosis was not good. We were told to gather the family and organise the funeral. Then, in what has become characteristic of Di's determination to live, she regained consciousness, and after 6 months of gruelling work at the Hampstead Rehab Centre, with Miles beside her every step of the way, she learnt how to talk again, and although paralysed down one side of her body, regained some mobility with the aid of a quad stick. Diane came home just after her 69th birthday, in time to celebrate her 50th wedding anniversary. At that time, Miles was fit and healthy. While Di was in Hampstead, he had renovated the house to make it wheelchair friendly, and when she came home, he took on the role of full-time carer. Di set herself daily goals to get her mind and body functioning again. Over the next 6 months, Di gradually improved. At this time, Miles, however, started to wear out. Showering and dressing Di and administering her medication and supporting her in so many ways left him exhausted. It was time to put Di into respite care to give him a break. And then came the challenge of finding a suitable respite facility, one that could respond to Di's high physical care needs while recognising that intellectually she was still very alert and with it. This proved exceptionally difficult. The only respite bed available was in a dementia ward. Needless to say, this did not work well. Di was very distressed in this environment. She felt isolated, as most of the other clients had limited verbal communication or the capacity for social interaction. She felt that this was not a place where she belonged, and she did not want to be there. She felt confronted and scared. Was she going to be left in a place like this to slowly degenerate? Her distress then became ours, and needless to say, we took her out of there. Another time, as part of recreational therapy, she was asked to colour in a children's picture book. She felt very insulted. Later, we were extremely fortunate to get Di into respite at Arwindor. This is a well-designed, specific-purpose respite centre. Clients have their own room with ensuite and are treated more like guests at a resort. The activities program is intellectually stimulating and facilitates social interaction. As a low-care respite centre, we had to buy in additional support services to shower and dress Di and put her into bed, and we were very happy to do this. But we felt extremely frustrated when we were later informed that this arrangement would not continue and we would have to transition Di into alternative care. After being on a waiting list for some months, Di was eventually allocated an each package. Initially, this was used to provide in-home respite twice a week. This gave Miles the opportunity to get out of the house, albeit mainly to do the shopping, and Di enjoyed the company and stimulation of her carers. Everything seemed to be settling into a well-oiled routine when Miles started experiencing serious lower back pain, exacerbated by him getting Di in and out of bed, often a few times each night. He progressively got worse and was eventually hospitalised and in rehab for several weeks. This was a particularly stressful time. I was able to get emergency in-home care for Mum the first night when I took Dad to hospital, but it took another 2 days before a nursing home bed became available. I felt fortunate the nursing home was so close to me, but then came the daily distress calls from Di. As a result of the stroke, Di is unable to walk without a leg brace. Unless this is fitted correctly, she simply cannot walk. Nursing staff consistently found it difficult to put the leg brace on properly, despite us regularly demonstrating how and having a step-by-step photo board to follow. Not being able to walk took both a mental and a physical toll on Di's health. It was a relief for the family when Miles came home. He now needs a walker to get around. He can no longer put Di to bed at night so carers now do that as well. They are wonderful people and do a fantastic job. Di had a second stroke late last year. It took 23 hours to get an emergency bed, then 5 days in a public hospital with an appalling lack of coordinated care, before thankfully getting into a private hospital. She then went back into rehab, and once again we experienced the same problems of staff being unable to fit the leg brace. Di and Miles are now both back home, and that's where they want to stay. What they need is continued provision of coordinated in-home care.
1, 2, 3, up. Good, very good.
What I need for my peace of mind is to know that if and when required, alternative nursing home care is available, one which is patient-centred, where the staff do know how to fit a leg brace, and one that can respond to the unique physical, intellectual and emotional needs of each individual.
As you've seen, her experiences raise a number of issues, including the positive impact of people's determination to overcome illness and the importance of enabling support from service providers, the lack of suitable respite care and the physical and emotional impact of inappropriate care, insufficient consideration of the unique intellectual and social needs of each individual, the impact of poor communication and lack of respect for the role of family carers, the inability of providers to learn a task fundamental to the patient's autonomy and quality of life, the importance of supporting people to be safe and well in their own home, not only for their own care and quality of life, but also for the sustainability of our healthcare system. And lastly, more coordinated home care is required.
For me, the most important thing is that when a nurse or a medical staff person sees either mum or dad or any other person, patient, that they look beyond the fact that they're there for physical health needs and they try and see the person as a whole person. And I think that's quite difficult. I think when people see someone that's aged or infirm, that's what they see. They don't see that actually here's a person who's had a huge, tremendous life experience and who that person really is.